and welcome to 4 Women, 4 Health, a podcast where holistic health practitioners come together to empower you with expert insights and practical tips on a wide range of topics, including gut health, nutrition, mental well-being, and making informed decisions. Join us every Monday for a dose of inspiration, education, and empowerment as we explore the transformative impact of holistic health on our lives. Thank you for tuning in.
Welcome to 4 Women, 4 Health, where we dive into the essential building blocks of holistic health. I'm Carlee, and I'm joined by Jynell, Brooke, and Meg, and in today's episode, we're exploring the powerful concept of informed consent. Imagine making healthcare decisions with clarity, confidence, and peace of mind, knowing all the facts and having a say in your family's well-being. Informed consent isn't just a legal requirement, it's a vital conversation that puts you at the heart of your health journey, ensuring your choices reflect your values and needs. Join us as we uncover how informed consent empowers you to take charge of your health with knowledge and confidence. So, I'd like to ask you guys, what does informed consent mean to you?
Informed consent to me is truly being educated on all of the risks versus benefits so that I can make the best, most educated choices for myself and my family.
Yeah, it's a privilege and it's a responsibility that we all have for ourselves and our families. From my perception, it's a way to uncover the true, the factual information behind the things that we experience in our lives as far as our health and our decisions that we make for our families for their future. And I feel like too often it's overlooked as something that is out of character, maybe unconventional, but really at the end of the day, it's a responsibility that we have to ensure that we are setting ourselves up for success, in my opinion.
Yeah, I totally agree. I think it's just being, like Meg had said, educated on the risks, the benefits, just making an educated decision, not feeling inclined to sway one way or the other, just, sitting, making sure it sits right with your gut and, all the facts about it and making those decisions from there.
Another thing about informed health consent is understanding the language, because a lot of doctors don't say it the way a normal person would understand.
I think it's important to recognize that while, healthcare providers are there to share with us, the risks, the benefits, and provide us all of that information, we are, the experts of our own bodies and of our children's bodies. And so, at the end of the day, I think it's a learning curve for all of us still, because I don't think informed consent has been something that we are truly used to. And I think the language is confusing because so many of us are just so quick to give our power and trust the experts because that's what we've been taught. Not that that's not an okay thing. You want to have, the right team of healthcare providers that are best going to help you and your family in the ways that are, bio-individual to you, first and foremost, and also so that you feel, good in your gut when you're making these choices. Your intuition is being taken into consideration, and you're not left feeling like you're guilted into something or, you're shamed for making a choice for your children because the expert, doesn't agree.
Yeah, I couldn't agree more, and I feel like it really brings about the topic of bio-individuality and how, nobody is the same, and healthcare and, everything that we do for our health is not one size fits all. It's not black and white, and so I feel like to make an informed decision is vital when it comes to, speaking to what you and your family need individually. And I feel like it's so important when you're making decisions that can impact your future or your child's future, that they're decisions where you feel fully supported in making them. And just like you said, understanding the language and feeling like you can ask questions without being judged or question yourself for asking a question or kind of nudged off like there's not enough time to really go over it. It could really be really hard and confusing because then it makes you feel like, oh, well, maybe I should just, ignore my gut and just go with what is being told to me, because that's all the time that we have to discuss today, or something of that nature. So I think that it really brings about this idea of like, well, you know in your gut if there's something wrong with you or with your child, and really just coming to the conclusion that when you do make a decision that you are feeling fully supported and heard before doing so. And sometimes that may look like, asking more questions, changing provider, doing your own research, picking up a book or looking at the facts, so that you then can well equip yourself with the right guidelines to ensure that you are getting the answers that you deserve about the decisions that you're making, because sometimes once you make those decisions you can't go back. So it's just so important, in my opinion.
And I think to that, I think informed consent is also, like we were saying, the bio-individuality. I think it's different for everybody. There's different risks, there's different alternatives, different benefits. So I think, again, it's not, like you said, Jynell, it's not just like a one size fits all. It's very different for each family, for each person, depending on, their needs and their health goals and all. So I think that's very important too, that it's just not cookie cutter as well.
Yeah, absolutely.
And I think, at the end of the day, it's really important to understand that you are hiring your healthcare providers. You are the one ultimately that is paying to receive a service. And whether that be for you or your children, you have a right to ask any and all questions when you are paying for something like that. It's an investment, you're making when it comes to your family's health, and you want to feel like you're making the best choices, and that, what you are investing in, you're going to feel good about. I think that comes with anything we do. And so I really encourage people to kind of shift their perspective, because at the end of the day, we can all be experts on anything these days. Like, you can read books and you don't even need to go to college to become an expert in something these days, truly. And so I think with all of the resources that we have, the advancements in technology, the amount of parents that are talking to each other in social media groups, in their communities, because of the experiences that they've been through. I think at this point, the conversation needs to be had at a different level than we've been having it, because I think a lot of people are very afraid, and they make decisions because they're fearful, and they're, not willing to be brave enough or be vulnerable enough, because they don't want to get met with resistance. It doesn't feel good when someone's telling you, that a choice that you make might put your child in harm's way. But if you feel in your gut that the choice they're telling you to make could put your child in harm's way, you have every right to dispute that and research that and bring the resources and the studies and the data with you. And if, your provider is not willing to even look at any of it, that should tell you something right there. That's a red flag right there. And at the end of the day, we have to remind ourselves that everybody goes to work. And so, we want to hire people that put people over profit. Because if you're a good provider and you really put the needs of your patients and clients at the heart of your practice, you will make a great living and be blessed, because you will have people that trust you. You will have families that will continue to, utilize your services as they grow their families, and as we share with people in our communities, who these trusted healthcare professionals are. That will be a blessing versus, doing things because the science says to do this, but we know from the evidence we're seeing and the data we're seeing in our own practices, or, when we look at our children, that it doesn't always add up. 1 plus 2 doesn't always equal 3. And so I think it's extremely, extremely important to get to know your providers. And how do you do that? By asking questions, building relationships with them. The same way you would with your hairstylist,
I think you bring up a good topic, because the truth is that, first and foremost, we're not here to bring medical advice. We don't cure, treat, or, diagnose illness, but we've all had our own experiences and we're all practitioners. So we have the knowledge, whereas, someone else who may not be in this, career path might not. But what you brought up was, the patient over profit. And so something that I think is important to bring to everyone's attention is that, a great way to decipher whether or not you're with the right provider is how they make you feel about the questions that you ask. So we're not here saying that you won't go along with what your provider suggests, and we're not here to say don't go along with what your provider suggests. We're saying if it doesn't feel right, if it doesn't look right, if it doesn't sound right, don't feel ashamed for having, for recognizing that, and don't feel scared to continue to pursue, to uncover why you're feeling like that, but rather be open to new possibilities of getting to the place in your healing path where you are surrounded by providers that are taking you seriously. And so, piggybacking off of what Meg said, if you're in an appointment and you feel like you're being rushed, or you're being, being given one or two word answers to a really important question to you, then that might not just be the right provider for you. It doesn't mean that they're wrong or that they're doing anything to harm you. It's just maybe they're not aligned, or maybe it's not the right provider. And I've had my own personal experiences where, I had a provider for a child, and this provider, it was very clear that they basically were like one size fits all. They weren't even really hearing the fact that I was bringing up things that were bio-individual, very, very individual to my son. And I almost felt as though this individual was just like reading out of a book, and it didn't sit well with me because I was like, well, you're not seeing what I'm saying. And so I decided to find another provider, and that other provider listened and actually consumed the information that I was sharing. And then as a result, agreed, like, oh yeah, I definitely see that. And that practitioner was also like a medical doctor. So like, just putting out there that it doesn't mean that, that doctor is bad, but it may not just be the right fit for you and your family. And so maybe you start to pursue a different type of practitioner or a different practice altogether. It's not going to make you feel good when you go home and you make a decision that you truly weren't committed to in the first place. So thanks for sharing that, Meg, because it really just sparked that in me.
Well, and I want to piggyback off of you because one of our practitioners is sitting on this call, and for us, Dr. Brooke has been a blessing in our family. My son was struggling with his gut health and constipation, and that's really one of the main reasons why I chose to move forward in my career as an integrative health practitioner and specialize in gut health and mental wellness. And, we had left our practice during COVID because we were no longer able to attend there. We were seeing doctors at a private practice all the way out in Lewiston. So we were driving a good 90 minutes. And even with going to, where we were going, for our family, there were some things that we didn't fully align with. And so it was nice because I had Brooke, who also has a great understanding of pediatrics, and she understands chiropractic, and she understands constipation and how little bodies move and how they work. And for us, we were able to see her, and my son still sees her on the regular. I see her on the regular. But seeing Brooke and having a chiropractor, as part of our wellness team, provided my son with constipation relief that didn't require any medication or supplements that were possibly going to cause him more harm, even though it was essentially helping him go to the bathroom. So when I, first started out as a mom, like, no one ever talked to me about chiropractic. No one ever even, it was like, oh, you don't want to take your baby to a chiropractor. And I was like, what? Like, the chiropractor has been one of the best, parts of our wellness journey. And we consistently see Dr. Brooke because we can see the difference in our son since we've incorporated that into his lifestyle. And so that has been amazing in that regard, because there are other practitioners out there, and maybe it's not, your PC, maybe it's, a chiropractor who can offer you solutions and truly help you get to the root, of the issues with you and your children, but also be willing to have discussion and provide you with education, which is exactly what Brooke has done for us.
Brooke, how do you know that everybody, like your patients, have all the information?
I would say as a practitioner, well, one of my biggest parts of my job isn't, the diagnosing and the treating, it's the listening. And we do get that a lot in chiropractic school. I will say I am so thankful for that. We are definitely taught that it's not always the hands-on, treatments that are going to heal somebody. It's going to be listening. And if I'm not the right provider, I am more than willing to, refer out, usually do the research myself and try to get those answers. So I guess it's listening. Listening is the biggest thing. Like Jynell had said, the red flag if you present your practitioner with a question and they start getting defensive or, just short about an answer or something like that. So I think I really resonate with that. I think that, again, if I don't know the answer, I'm not just going to say, nope, that's not true. That's not it. I will be open and honest and say, listen, I'm not very well educated in it. Let me do my research and we'll, reconvene at the next appointment or refer out, honestly. So I think listening to our patients and just kind of meeting them where they're at.
I love that so much, and I feel like I can agree. I mean, within like as an integrative health practitioner, I've actually done that very thing as far as like recommending, you may want to go back to your doctor and get some blood draw work or bring this lab to them and show them. And I think it's like there's this I don't even know if it's the traditional, but it's this like suggested way that like you're supposed to have a general practitioner and they make all the decisions and that's that. But looking at my own personal family, like we have a chiropractor. I have to say the exact same. My son, when he was born, he had reflux. We could not set him down. Bringing him to the chiropractor and changing my diet when I was breastfeeding was a godsend. So if you've not explored chiropractic for your child, definitely something that I agree. But like even looking at our family, we have acupuncture. My little boys have a functional pediatrician in addition to their regular pediatrician to help get to some of the root issues. So I think it's also just understanding that sometimes to get the support that you deserve, it may, like Meg said, you're hiring your providers. It's like it may require you to have more than one. Just like in modern conventional medicine, there's a specialist. And I think too, like a lot of people don't realize that when you go to a specialist, it's their job to look at one thing and they may be giving you advice based on one particular thing, which is their job. It doesn't mean that they're wrong if they're not catching something else, if they're doing their job. Some medical doctors, they don't have time to study and understand everybody's system. So sometimes, in order to get the full picture or really get to the root of something, you may have to find a different type of provider, like a more functional, naturopathic, integrative person that has dedicated time to listen, just like Brooke said, that's the key word, listen to you, help get to the root or get to your health history enough to look at you as a whole person. And sometimes that's the missing piece is, not to talk up our profession, but I'm sorry, I'm a big fan because at the end of the day, like what providers that look at the whole picture do is they provide people with solutions. And a lot of times I think that you go in with a symptom and you come out with a Band-Aid solution because that's what that provider was taught to do, and they're not meaning any harm, but a lot of people need to understand that, taking a medication isn't always the end all be all. Sometimes it'll help a symptom, and sometimes it is recommended for a temporary relief or whatnot. But when it really comes to setting yourself up for a successful future, even if you are on a medication, you may still have to make those lifestyle adjustments behind the scenes. And most people don't even know what those adjustments are. So it's like asking those questions and going into every appointment with this idea that I need to know as much as I can about this, or I need to even ask my doctor for resources or articles or books or something so that I can ensure that there's nothing that I'm missing. And so I think that that's like a really important point as well.
Yep.
You know what's
I would
interesting is I went to, so when one of the kids, I don't remember what was happening, but I had brought up to our doctor, like I was in school, so I was reading all these articles and I had looked something up that was going on with them, and I mentioned it to him, and he's like, I've never heard of that before. And it was like there was like 50 research articles, and I'm like, cool. It's cool.
Well, and that's, the benefit of collaborating and working with other practitioners because, we don't have the time to learn it all, but there should be a baseline understanding of the fact that the body works as a whole. The body can heal and the body works as a whole. And when you support the body will do beautiful, amazing things. But if you're isolating the different systems of the body and you're trying to heal something by turning off another system and suppress something else, you end up, in a state of dis-ease, which that's, when all these imbalances start to present. And so for any one practitioner to think that they know all and have all the answers, they're doing you a really big disservice because truthfully, our experiences, can make us more educated and help us to uncover things that we didn't know once before because you go through it and then you know better and you can do better. The fact that, we all come from different places with different means of education. We've worked with different clients. You learn from your clients. I always say, I'm a forever student as much as I'm an educator. And so I think more than anything, your healthcare should look like a team. It should be a team effort. That's how we heal. It's not going to be somebody being, the expert and have that like ego as if, if you don't do what I tell you to, then, you're never going to get better or your body's not going to heal. Like that is not for anyone to ever say to any of us. And I think, the mind is also really important. And if we have providers that essentially are making us feel less than and we're fearful and we don't want to ask the questions because we feel like they're going to shut us down, well, your mindset, that's not a good place to be for healing either. So, you're leaving your office and you're supposed to be feeling better, but really that you got to start here because that's going to affect, how your body is feeling physically, emotionally, spiritually, all the things. So I just, it's definitely one of those things where if we know better, we can do better and we can be better. And the only way we can know better is by asking the questions and not being afraid to ask those questions,
Yeah. And as a mom of four, like it makes me like I just want to talk about this because I've learned firsthand that I was at one point in my journey, I have a 12-year-old, okay, and I also have an 18-month-old. So like I have had different phases of my journey, but as a mother of a 12-year-old back then, I look at how different things are. Like I did not ask questions. I just came in. It was like, do what you got to do, get out, and it was like an assembly line type of thing. And then I started to make connections because I was like, okay, my kid is like not feeling the best. Then I had my second child. He had chronic ear infection. Like things just weren't adding up. So now the more informed version of myself, sometimes the questions that I ask, like you don't have to be a doctor or an expert to like understand and see the answer. And I'm not going to get into anything specific here, but like, for example, if you were to say, if I were to move forward with what you're suggesting, could it be harmful? Ask that question if you don't know or if you have a fear, and the answer will speak for itself. I started asking really tough questions at my children's appointments, and the answers that I received made it crystal clear what the best decision is. So it isn't always textbook and it isn't always clear cut. Like, you might go in there and say, I'm so confused because this is what's being recommended to me, so I feel like I have to do it. But when I asked a question, which is the most important question to me, is this safe? The answer was like, it made me uneasy, like it was concerning. That is the intuition that we speak of. Like, that's when you know, I gotta go get a second opinion. I have to seek, research otherwise, and come to a conclusion of what is best for my family. And I think that is like the greatest lesson that you could take from this episode today, is that what is best for your family might not be the same as like your neighbor or your friend, and that's okay. It's your privilege and responsibility to have a say and to be able to make a decision that impacts your family forever. And that is the beauty in this, is that you can learn how to just be a part of the decision making. That's all we're saying. We're not saying go against anyone or fear your doctor by any means. We're just saying be a part of the conversation, be a part of the decision making.
And don't be afraid to say no either.
You're on their team and they're on your team, and that's ultimately what it should be. It should be a team effort, and everyone should have the mutual interest of wanting to do what's best for the bio-individual person.
Absolutely. Dr. Brooke, I know that you were sharing something that you learned this weekend that was really interesting. Did you want to share that?
Yeah, absolutely. So we were talking about, informed consent and decision making, and I think we touched on every single one of them. But a little term that I learned was BRAIN. So it's benefits, risks, alternatives, trusting your intuition, and then doing nothing. So, if you're presented with a decision from your practitioner or your doctor, those really are your options. And it doesn't mean, deciding any of them is the right answer, the wrong answer. It's just you should know all of them, the benefits, the risks, the alternatives, listening to your body. And I think one of the biggest things that the lecturer drove home was, if it's something that needs to be made right then and there, a decision that needs to be made right that day, asking for a few seconds, a minute alone from you and your provider, just so you can sit with your thoughts and think about it. So I think it's definitely important too, if your body's screaming something, or you're educated in this manner and you just can't get those words out, to ask those right questions, taking time and just thinking about it.
I love that so much.
Me too.
Well, this was a really amazing conversation. I feel like we could all agree that we could talk about it for hours. We're all very passionate. We have so many different experiences that we could share with you. This really important topic. Meg, do you have any like last minute suggestions that that they can implement? Like maybe one thing that they can implement, our listeners can implement just moving forward today, and then we can tell them the exciting news about our next episode, what that's going to be on.
So I think, honestly, the best thing that you can do going forward is research and bring it to your provider. I mean, it's literally just a matter of finding credible research. I think all of us know the difference between WebMD and finding an actual research, journal that you can print out and give that information to your providers, because if anything, if they don't know, you've just brought that to their attention. And again, when you know better, you can do better and you can be better. So don't show up, empty-handed. Utilize your resources and don't be afraid to bring it to the table, because at the end of the day, you might just teach your provider something that could change the entire way they practice going forward.
I love that.
Oh, it's so powerful. I love that so much. It's so true.
I think it's been the case with all of us, so we know firsthand.
We sure do.
Definitely.
All right. Well, thank you so much for tuning in with us today. We are so excited to share more of this really passionate project that we have with you. Next episode, we're going to dive into a little bit more about your lifestyle choices and how those can be so extremely powerful is basically your superpower when it comes to healing and making health decisions is your lifestyle and the decisions that you make that may seem mundane and silly. All of those little things that you do each day, they create this lifestyle that basically has the potential to make you or break you. And so we're going to go a little bit deeper into that next episode. So we hope to see you there. Thank you so much.